Hello everyone, welcome to MGK Educare. Today we will discuss most asked top 20 MCQ related to human heart. This video might be helpful for your BSc Nursing exam, your nursing competitive exams, and also might be helpful for your NEET preparation. So here we go. First question: the human heart is located in the option A, right thoracic cavity, B, left thoracic cavity, C, mediastinum, D, abdominal cavity. So the correct answer is C, mediastinum. Heart is located in the center part of the thoracic cavity between the lungs. Between the lungs, that center part of the thoracic cavity is known as mediastinum, where the human heart is located. Clear? Now next move to the next question. How many chambers does a human heart have? Option A 2, option B 3, option C 4, option D 5. Human heart have 2 upper chambers and 2 lower chambers. 2 plus 2, we have 4. Total we have 4 chambers in our heart, 2 upper and 2 lower. So here the correct answer is option C, 4 chambers. The 2 upper chambers are known as right atrium and left atrium, and the 2 lower chambers are known as right ventricle and left ventricle. Clear? Next question. Which chamber of the heart pumps oxygenated blood to the body? Now let us have quick discussion about the blood circulation in the human heart. Here we can see this one is SBC, is IVC, superior vena cava and inferior vena cava. This right atrium, left atrium, right ventricle, left ventricle. This is pulmonary artery, and this one is aorta, and this one is pulmonary veins. And we have in between the right atrium and the right ventricle tricuspid valve. This valve is known as tricuspid valve, and between the right ventricle and the pulmonary artery we have pulmonary valve, and in the left side between the left atrium and the left ventricle we have bicuspid or mitral valve, and between the left ventricle and the aorta we have aortic valve. Okay, this one is also pulmonary vein. So the deoxygenated blood from the SBC, superior vena cava, and the IVC, inferior vena cava, comes to the right atrium, and from the right atrium via the tricuspid valve it comes to the right ventricle, and from the right ventricle the deoxygenated blood from the right ventricle goes to the pulmonary artery, and from the pulmonary artery to the lungs. And on the lungs, and on the lungs the oxygenation takes place. After that, the oxygen-rich blood it returns back to the heart via the pulmonary vein to the right atrium, via the right atrium, and from the via the pulmonary vein to the left atrium, not right atrium, it's left atrium. From the left atrium via the mitral valve it comes to the left ventricle, and from the left ventricle to the aorta, and from the aorta to the whole body. Okay, clear? So this is the brief discussion about the blood circulation in the human heart. I think everyone is cleared. Now let us see the question number 3 again. Which chamber of the heart pumps oxygenated blood to the body? Here we can see option number A, right atrium, B, left atrium, C, right ventricle, D, left ventricle. And here we can see that which chamber pumps oxygenated blood to the body. So they are asking the chambers and not the vessels, not the blood vessels. So the right answer will be left ventricle. Left ventricle. Option number D is the correct answer. Now let us move to the next question. Question number 4. The valve between the left atrium and left ventricle is called. I have mentioned in the previous slide. Now let us discuss again the valve. So we have 4 valves in human heart. 2 AV valves known as tricuspid valve and bicuspid valve, also known as mitral valve, and 2 semilunar valves, semilunar valves, aortic valve and pulmonary valve. Okay, so as I have mentioned earlier, the tricuspid valve is located between the right atrium and the right ventricle, and bicuspid valve or mitral valve is located between the left atrium and the left ventricle, and aortic valve is between the left ventricle and the aorta, and the pulmonary valve is between the right ventricle and the pulmonary artery. So now let us come back to the question. The valve between the left atrium and left ventricle is. So here we can see the valve between the left atrium and the left ventricle. This is left atrium and left ventricle. Which valve is present? Mitral valve, right? So the answer is bicuspid or mitral valve. Clear? Next move to the next question. Question number 5. Which blood vessels carries deoxygenated blood from the body to the heart? As discussed in the previous slide, we know that SVC and IVC. SVC brings deoxygenated blood from the upper part of the body, and IVC bring deoxygenated from the lower part of the to the right atrium. So here the correct answer is option number C, vena cava. Question number 6. The pacemaker of the heart is. We all know that the pacemaker of the heart is SA node, sinoatrial node. It is also known as the natural pacemaker of the heart. It is located in the right atrium, somewhere between here, near the opening of the SBC. Clear? Now let's move to the next question. Question number 7. Which of the following arteries carry deoxygenated blood? So we know the artery that carry deoxygenated blood is the pulmonary artery. Aorta, it carries oxygen-rich blood, and pulmonary artery, it carries deoxygenated blood from the heart to the lungs for oxygenation. And aorta, it carries oxygen-rich blood. To the body. Next question. The function of valves in the heart is to. So these valves have certain functions. So what does these valves do? These valves prevents the backflow of blood in the heart. Okay, the correct answer is prevent backflow of blood, option number B. This valve acts like one-way door, ensuring blood flows in a single direction by preventing backflow. Okay, I think it's clear. Now let's go to the next question. Which of the following carries oxygenated blood to the heart? Oxygenated blood to the heart. So the oxygen, after oxygenation, the oxygen-rich blood from the lungs, it is brought back to the heart by the pulmonary veins. So the correct answer here is option number A, pulmonary veins. Next question. Normal heartbeat or heart rate in a healthy adult is approximately option number A 40 to 60, B 100 to 110, C 60 to 100, D 120 beats per minute. And the correct answer is option number C, 60 to 100. And the heart rate more than 100 beats per minute is known as tachycardia. And heart rate less than 60 beats per minute is known as bradycardia. Clear? Next question. The wall that separates the right and left sides of the heart is called. So our heart is divided into the right side and the left side, and here in the middle we can see there is some wall like things, so it is known as the septum. This is known as the septum. It prevents the mixing of deoxygenated with oxygenated blood or oxygenated blood with deoxygenated blood. It prevents mixing of oxygenated blood with deoxygenated blood. As we all know that our right side of the heart, it carries deoxygenated blood, and left side it carries oxygenated blood. So it prevents the mixing of this oxygenated and deoxygenated blood. Clear? So the correct answer here is option number C, septum. Next question. Which blood vessels carries oxygenated blood from the heart to the body? So option number A, pulmonary vein, B, aorta, C, vena cava, D, pulmonary artery. So the oxygenated blood from the heart to the whole body is carried by the aorta. This is also known as the largest artery the human body. Okay, aorta. Next question. What type of muscle is the heart made of? Option A, smooth muscle, B, skeletal muscle, C, cardiac muscle, and D, voluntary muscle. And the correct answer is option C, cardiac muscle. Cardiac muscle, it is striated, meaning it is like strip or like banded like appearance can be observed under the microscope, and involuntary meaning it is not under the voluntary control. It is regulated by the autonomic nervous system. Clear? Next question. Which node transmits the impulse from atria to ventricles? Option A, SA node, B, AV node, C, Purkinje fibers, D, bundle of His. And the correct answer is atrioventricular node, AV node, option number B. Question number 15. Which part of the heart receives blood from the lungs? Option A, left atrium, B, right atrium, C, right ventricle, D, left ventricle. So the oxygenated blood from the lungs, it travels back to the heart. So the left atrium, it receives the oxygenated blood from the lungs via the pulmonary veins. Clear? So the correct answer is option number A, left atrium. Next question. Question number 16. The heart is enclosed in a double layer sac called. So we know that our heart has three main layers, namely endocardium, innermost layer, myocardium, middlemost layer, and epicardium, outermost layer. But the heart is also enclosed by a double layer sac and is known as pericardium. So the correct answer here is C, pericardium. Pericardium, it has two layers. It contains fluid and it lubricates and protects the heart. And it has two layers, outer fibrous pericardium and inner serous pericardium. Serous pericardium. This outer fibrous layer, it is the thickest outer layer. Okay, this is the thickest outer layer. I hope everyone is clear. Next, move to the next question. The blood pressure during the contraction of the heart is called. So what is blood pressure? So blood pressure is the force of the blood pushing against the wall of arteries when the heart pumps blood throughout the body. So we can measure two blood pressure, one systolic blood pressure and diastolic blood pressure. Systolic blood pressure, it is the maximum pressure in your arteries which is measured during contraction, and diastolic blood pressure, it is the minimum pressure in your arteries when the heart is at rest, meaning during relaxation. And we know that the normal blood pressure of a healthy adult is 120 by 80 millimeter of mercury. So the correct answer here is systolic blood pressure. The blood pressure during the contraction of the heart is called what? Systolic blood pressure. Option number B is the correct answer here. Question number 18. Coronary arteries supply blood to. Option number A, brain, B, lungs, C, liver, D, heart muscles. And the correct answer is heart muscles. Question number 19. The sound lub-dub of the heart is caused by. So we know that we have two normal heart sounds. S1 is lub and S2 is sound as dub. They both are caused due to the closure of the heart valves. S1 is caused due to the closure of the atrioventricular valves, and S2 is caused due to the closure of semilunar valves. Semilunar valves. Atrioventricular valves, we have two, tricuspid and mitral valve. Semilunar valves also we have two, that is aortic valve and the pulmonary valve. So here the correct answer is option number A, closing of heart valves. Question number 20. ECG, which stands for electrocardiogram, is used to measure Option A, blood pressure. Option B, heart rate. C, electrical activity of the heart. D, pulse rate. So the correct answer is option C, electrical activity of the heart. So for today we have only 20 MCQs. I hope you all have understood. So thank you everyone. Please like and subscribe our channel.